Okay, good morning everyone. Today our colleague Dr. Shadan will talk to us about a nice topic that I think all have limited experience in it. That's the ultrasound of the eye. So, please, Dr. Shadan.
Good morning, everyone. Today I will discuss the ultrasound of eye. I try to discuss it briefly. It's a simple procedure and it's easy to understand. First, I would like to start with the anatomy of the eye, brief explanation of the anatomy. The eye globe is divided into two segments, anterior segment and posterior segment. Within the anterior segments, we have two chambers, anterior and posterior chamber. And these two chambers are divided or separated by the iris and ciliary bodies. This here, the anterior chamber, and this is the iris and ciliary bodies, and this is the here posterior chamber, but it's very small, and this lentiform shaped is the lens, and posterior to it there is a vitreous body which contains vitreous, and this is here is the refers to the posterior segment. Here we can see the cornea, which is anteriorly this part, anterior, this convex part cornea, it's a transparent part, and this connected directly to the sclera. This the outer part, the fibrous coat that part, the outer layer of the eye globe, and extend posteriorly and pierced by the optic nerve, and it's continuous with the dura sheath of the optic nerve. And this is the one is the optic nerve, which contains also the central retinal artery and vein. Posterior to the cornea, we have anterior chamber. This contains clear fluid, and seen by ultrasound, like clear fluid doesn't contain any echoes. And this is separated by the posterior chamber by iris. This one is the iris. This is contractile diaphragm, and in the middle there is this the pupil that the ophthalmologist looks to the eye from the ophthalmoscope, can see the posterior segment of the eye. Posterior to the iris and ciliary body, we have posterior chamber. This is a very small chamber and cannot be seen with ultrasound. This lentiform shape is the lens, has anterior and posterior capsule, and posterior to the posterior chamber and posterior to the lens, we have the posterior segment. In the posterior segment, we have vitreous. This contains jelly material, vitreous, and this holds the retina in place, cause pressure on the retina and hold it in place, and don't allow to cause any detachment.
So we have the anterior segment and posterior segment.
Yes.
Anterior segment contains anterior chamber or posterior chamber?
Yes.
And the posterior segment contains the
vitreous.
bulk of the
Yes.
eye, the vitreous.
The vitreous, yes. And the layers of the eye globe, three layers. The innermost layer is the retina, which is the sensory part. This one, very thin retina, and anteriorly it forms the ring-shaped wavy structure called ora serrata. So the retina ends at the ora serrata anteriorly, and the middle layer is the choroid. This is very vascular layer and extends more anteriorly than the retina, and ends in the ciliary body and the iris. The outer, as I said, it's sclera, it's fibrous coat, and this extends with the dura sheath of the optic nerve. Here we can see the layers more clearly. This one is the retina, the inner one, and the second, the vascular, is the choroid, and the outer fibrous coat is the sclera. This also here the anterior chamber, and the smallest one here is posterior, and separated by the posterior segment by the lens. Here the lens located in the anterior segment. So the structure in the anterior segment are the cornea, anterior chamber, iris, and ciliary body with the lens. These are all located in the anterior segment. And in the posterior segment, we have vitreous and the layers of the eye. This illustration of the ultrasound of the eye. The outer one here, we can see at echogenic line, this is the cornea, and beneath it, anterior chamber. We cannot see the posterior chamber, it's very small. And this one is the lens with its anterior and posterior capsule. and this is the vitreous and the layers of the eye, and this one retrobulbar area contains the optic nerve and retrobulbar fat and the muscles of the eye. These are the muscles. We have medial and lateral recti, superior and inferior recti, and superior oblique and inferior oblique. These are all inserted to the sclera, 0.5 millimeters behind the cornea, lateral to the cornea.
0.5 millimeters?
6 millimeters. 6 millimeters.
It makes more sense.
Yes.
6 millimeter posterior to the cornea.
Yes.
These are the conal muscles, the
yes.
extraocular muscles.
Yes.
So it will be two compartments, the extraconal and intraconal.
Yes.
Right?
Yes. Okay. Here the ultrasound of the eye, and the outer, this clear is the eyelid. This one, this hyperechoic layer is eye thick. This one eyelid, and beneath it, this echogenic line is the cornea. Beneath it, anterior chamber. Here the ciliary and iris and ciliary bodies, and this is the lens, anterior capsule, posterior capsule, and this vitreous chamber. It should be clear. And this is the layers of the eye globe. This thin echogenic line is the retina, and the choroid cannot be differentiated, and this isoechoic layer is the sclera. Here is the nasal part, nasal side, and here is the temporal side, or medial side and lateral side. This also we can see, this is the structure of the anterior segment. This is the eyelid here, and this line is cornea. This opening is pupil. This is iris and ciliary body, and this is the lens, and behind it vitreous humor. We have some indications of ultrasound of the eye. Either there is opacification of the transparent media, so the ophthalmologist cannot see through the ophthalmoscope and refers to ultrasound, and this opacification may be resulting from cataract or anterior chamber opacity like hyphema, or in a child with leukocoria. Leukocoria when there is a white pupillary reflex through ophthalmoscope. So this should be evaluated well, and some serious pathology behind it. Or in cases of vitreous hemorrhage and extreme meiosis. Meiosis when there is extreme constriction of the pupil, also there will be difficult in doing ophthalmoscope. And in case of ocular trauma and suspecting intraocular foreign bodies. And also if there is the suspecting global lesion or posterior wall masses and retinal detachment. These are some indications. Also, there are others, and I will discuss briefly. There is a limitation of this technique if the suspecting there is ocular globe rupture or significant periorbital injuries or significant retrobulbar hematoma. In this situations, we cannot do the ultrasound because we will exert more pressure on the eye, and this may lead to more damage. So it should be avoided, and CT scan may be better.
So mostly it's in cases of trauma, orbital
yes.
trauma, or
and severe ocular trauma. Yeah. Yes, in mild ocular trauma, or there is suspecting in a foreign body, it can be done. Okay. The preparation. The patient should lie supine and with a closed eye, and a copious amount of gel should be used because don't exert more pressure on the eye, and like in this case. The probes that we are using, either a linear array, or this is very good because it gives high resolution, and because the eye is superficial structure and contains fluid, this is not need more penetration. But if we are looking for the retrobulbar area and suspecting hematoma, or looking for the extraocular muscles, the microconvex pediatric probe will be better because it gives more penetration. The technique we will image in two plans, either transverse or sagittal. In the transverse, we should ask the patient to move the eye upward and downward. And in the sagittal, we should ask the patient to move it medially and laterally, or nasal and temporal side. So the protocol will be taking axial image in the entire globe from upper to the lower pole, on sagittal from temporal side to nasal side, and sometimes we take oblique views or the dynamic view, which is very important to differentiate the types of detachment. Some pathology that I will discuss. First, in the ultrasound can take the knows the information, gives information more about the size and morphological characteristic of the eye. In a normal adult, the anterior posterior diameter of the globe should be 22 to 25 millimeter. But in cases of long-term high myopia, there will be increase in the epidiameter of the ocular axis. This resulting from the stretching of the sclera and also called thin wall. And here, as in this case, we see the anterior posterior diameter is increased. This in case of myopia. And also in this case, there is the deformity of the posterior wall. This is focal uveal deformity. This caused by a focal bulge of the sclera, like it's called also ectasia, because there is thinning of the sclera, also in the case of myopia, and it's called staphyloma.
So we can diagnose myopia by ultrasound?
Yes. Okay, and in this case, this is bulby. This is when the eye is non-functioning, shrunken, and calcified. Also, it's called wood eye. In this situation, we see the eye globe is deformed and decreased in size, show some calcification, and sometimes, like this case, retinal detachment. This is calcified eye, and this may be resulting from trauma, angiomatosis, intrauterine environmental conditions, infection, genetic disorder, and in retinopathy of prematurity. This is phthisis bulbi, and we'll face it more on this CT and MRI. You can see there is small eye globe. Some conditions of anterior chamber, like in this case, there is a hyphema, which is bleeding in the anterior chamber. It may result from trauma. We cannot see this, like in this image. This one is normal. The anterior chamber is clear. We see it here. It should be clear because it contains clear fluid. But if there is echogenic, a hyperechoic material like this is hyphema.
It's a blood.
Yes, it's a blood inside. Yes. Some conditions of lens. First, discuss the cataract. Cataract is often age-related, and it may be also congenital or related to trauma and infection. And also, the ophthalmoscopy will be difficult to be done because of leukocoria and can't see the posterior segment of the eye. Cataract demonstrates three different appearances, like this intralenticular echos. There may be the echos between the anterior and posterior, anterior and posterior part of the lens capsule, intralenticular echos, or increased thickness and increased echogenicity of the both anterior and posterior wall, or just in the posterior wall. The main role of the ultrasound is evaluating structure posterior to the opaque lens. Okay. This is opaque lens, echogenic lens. This is here we see echogenicity of the anterior and posterior wall, and this one also with thickened and oval in shape, and this one increased echogenicity of the anterior and posterior wall and thickened. This is cataract in 3 different patients. It goes after this one is age-related, and the second one this is after trauma, and this after this after trauma, and this one after infection.
Okay, so it's either increased echogenicity of the anterior posterior walls,
yes,
increased thickness, or what else? Increased
echogenicity or intralenticular echos. Yes,
good.
It will be thickened and more oval in shape.
3 features of cataract. Good.
Yeah. Here is malposition of the lens. The lens is anterior part of it is attached, but the posterior is angled inside the vitreous. This is malposition or partial luxation. Yes.
This happens very common after trauma.
Yes.
Someone hits someone on the side, dislocates the lens.
Okay.
And before, like long time ago, it was treatment for cataract. They just hit him in the eye, dislocate the lens, and some light gets into the eye again before surgery.
And here there is complete displacement of the lens in the posterior segment. This is the lens and some vitreous hemorrhage with it. Here the lens is completely dislocated and located in the posterior wall. And in this case, we have here aphakia when there is absence of the lens. It's called aphakia, no lens. And here there is
congenital, يعني?
Yes, make congenital after operation. Okay. And here artificial lens is implanted called pseudoaphakia. This after surgery. In the iris, sometimes we see iris and ciliary body cyst, like in this case. This is simple cyst seen in the ciliary body, and it's important to distinguish these cysts from solid lesion. Some of the posterior segment pathologies, I will discuss vitreous conditions and retinal detachment, choroidal detachment, and posterior wall masses. The vitreous conditions, first, there will be some echoes, we may see some echoes in the vitreous, like this case, some low-level echo, isolated mobile echo within the vitreous, and that is moving in the dynamic study. This may be age-related, just small echoes. Here also you can see the cataracts present in the lens. This case, there is more echoes, more echogenic echoes, and forming an irregular shape, and they are moving in the dynamic study. And this is either crystalline or crystalline calcium and fat deposit in case of asteroid hyalosis, which is asymptomatic and related to systemic disease like hyperlipidemia, hypertension, and diabetes. And this we see this hyperechoic mobile echoes. It's most of the time it's unilateral.
Nice. So this is all asymptomatic?
Yes, but it is significant because it may cause posterior vitreal detachment.
Retinal.
Vitreal detachment, posterior vitreal detachment,
Yeah.
yes. And vitrectomy may be done for this case. The vitreal hemorrhage, this is very common, especially after operation. This may be traumatic, spontaneous, or related to trauma, and sometimes clinically the patient complains of seeing the black rain and decreased visual acuity. See the rain as black shadows in front and seeing. Ultrasound of the vitreous hemorrhage differ depending on its age and extent. In the mild acute case, it may be normal, or a slight increase in vitreal echogenicity, but in abundant hemorrhage, it may be mobile, poorly defined, and low-level echoes or hypoechoic clot may be seen with it. As in this case, this is echoes seen in the vitreous. It should be clear vitreous, nothing is seen inside, but here we see this echoes, and this is moving also with the dynamic study.
Don't you think it's difficult to distinguish?
Yes, it is difficult, but the first one here, this is more echogenic, and it is a calcium deposit.
Or even fat, you said?
Yes, fat and calcium deposit. This yes, like hemorrhage in this.
I think the history will be very helpful here.
Yes. And in this case, also this vitreous hemorrhage extensive. And this also the vitreous hemorrhage and associated with blood clot. This is blood clot inside. Also we see this here, lens is partly subluxated. Also this is echoes seen inside the vitreous. It somewhat looks like the vitreous hemorrhage, I think, but this is in case of vitreous infection, vitreitis. Just the difference with that of the hemorrhage, it's less mobile. The hemorrhage is more mobile, and this one less mobile. And in the case of hemorrhage, there may be some clot, and here we don't see clot. Posterior vitreous detachment. As in this case, this linear echogenic membrane that we are seeing in front of the optic disc, not attached to the disc. This is vitreous detachment. This is very mobile, especially in the acute setting. And it characteristically shows after movement. This after movement, when in the dynamic study, when the patient moving the eye and stops, but this membrane is still moving. Yes, it's highly floating. This is vitreal detachment. Retinal detachment, this is very important subject, and this is very common to see. This also in the case of retinal detachment, there is lines within the vitreous, and we have this, we see it, and mostly after trauma or tumor and exudative process. There are some types of retinal detachment depending on the underlying mechanism, either rhegmatogenous or retinal tear, tractional or separation of the retinal layer due to tugging by the vitreous membrane, and lastly exudative, in which the blood, fluid, or a lesion is present in the subretinal space.
So it's either something pushing, something
Yes.
pulling, or it's a tear.
As in this case, this one is a retinal detachment. This is two membrane attached to the optic disc posteriorly and anteriorly to the ora serrata. It doesn't extend anterior to the ora serrata, so we see it on the, this is here the 2 o'clock region, and here is 10 o'clock region. It doesn't extend more anteriorly, and attached posteriorly to the optic disc. And also this is also mobile on the dynamic study, and I think it's called flying angel sign. These two membranes is floating, and but posteriorly they are tethered to the optic disc, attached to the optic disc. And in this case, this is posterior vitreous hemorrhage, as I discussed. It's a membrane, thin membrane, seen in front of the optic disc.
And it's not connected to it.
Yes.
So if it's connected to the optic disc, it's retinal. If it is not, it is vitreous.
On the ultrasound, as I said, the retinal detachment appears as echogenic line that is fixed at the papilla and extend to the ora serrata. It forms acute angle with the typical V-shaped and also called funnel-shaped. The apex at the optic disc. The acutely detached retina is mobile with the appearance of floating echogenic line. In chronic detachment, the line is thicker, folded and fixed, and the retinal cyst may appear. And this case here is the acute retinal detachment, thin membrane, also associated with vitreous hemorrhage. This in front of it, vitreous hemorrhage. And this is the retinal detachment. It's thin membrane. And also said in the anterior, in the acute setting, there may be some vascularity in the retinal detachment. Just in the acute.
It will go.
Yes. This one chronic case associated with retinal cyst. It will be thicker, the membrane.
Thicker, less vascular,
And less mobile. Yes.
And less mobile. Good.
The dynamic study is very important in the case of detachment, and to differentiate the types of detachment. This is complete retinal detachment with subretinal hemorrhage. This hemorrhage is posterior to the layers of the detached retina. And in this case, there is also retinal detachment with vitreous hemorrhage. Okay. Another thing is choroidal detachment, which is caused by accumulation of fluid, serous fluid or blood in the potential suprachoroidal space here between the choroid and the sclera. As this one is the choroidal detachment, two membrane not attached to the posterior, not attached to the optic disc, and anteriorly extended, sometimes more anterior than the ora serrata. But here is this funnel shaped is retinal detachment and attached to the optic disc posteriorly. And this one is a vitreous hemorrhage, which is vitreous detachment, which is membrane in front of the optic disc and is highly mobile.
I think this is a very important diagram. There are 3 types of detachments. Each has distinct shape.
Yes.
The retinal detachment on the left, okay. Then the choroidal detachment in the middle, and on the right is the
Retinal.
vitreous detachment.
Yes, this vitreous.
Okay, keep this in mind.
This is choroidal detachment, and this sign is called kissing sign when the two membranes attached here somewhat attached to each other. This is the choroidal detachment. Posteriorly not attached to the optic disc. This is the area of this optic nerve, and here area of the optic disc. And anteriorly it may extend more anterior to the ora serrata. In your case, this is choroidal detachment with vitreous hemorrhage. This is hemorrhage inside the vitreous. In this case, this one above is the retinal detachment. As we see here, this retinal detachment, and that one is the choroidal detachment. The difference. Here it's attached to the optic disc posteriorly, but in choroidal not attached to optic disc. Okay. Posterior wall masses that we have, I will discuss some of them. First, choroidal melanoma. This is the most common primary malignant tumor of the eye in adult. This one. The ultrasound finding of the choroidal melanoma are collar bottom shape with base over the choroid. And the echogenicity will be low to medium. This is a very highly vascular tumor on ocular Doppler. This one. And here, this one.
What's this echogenic thing in the middle?
This, I think, vitreous hemorrhage inside the vitreous. This one is the mass. Also, another characteristic feature of the melanoma is choroidal excavation. It will excavate the choroid beneath it, like in this one here, and penetrate more to the choroid.
Invade.
Yes, invade the choroid. This characteristic sign of choroidal melanoma. And here the vascularity. Also, there is metastasis to the eye, and this is most commonly in female breast and in male lung tumors caused it. At ultrasound, it shows sometimes multiple flat or discoid hyperechoic. But in the melanoma was low or medium, but here hyperechoic, irregular surface. It's highly vascular with a broader base than the melanoma. And the vascularity is more than that of the melanoma.
So if the base is wide, it's more in favor of metastasis.
Yes.
If the base is narrow, like the collar bottom that we saw previously, it's more in favor of melanoma.
In case of melanoma, the AP diameter will be higher than the
higher than
broad.
wide.
Yes.
Or taller than wide. With little breast masses.
Yes.
Echogenicity high pupil melanoma, high
Yes.
pupil metastasis.
Hemangioma is another types of mass in the posterior segment. It's a vascular malformation that may be isolated or multiple in case of Sturge-Weber syndrome. It's most commonly located in the orbit, but it may be seen in the ocular globe also. Different types of hemangioma may be capillary or cavernous. Multiple hemangioblastomas, vascular neoplasm are seen in patients with von Hippel-Lindau syndrome. At ultrasound, they are hyperechoic, dome-shaped with a broad base with no choroidal excavation that we see in the melanoma, choroidal excavation, but it's not present here. Multiple lesions may be present on color Doppler, not show increase in vascularity, not that of the metastasis. Its vascularity is very little. And sometimes there may be echogenic shadow on the surface and the calcified shadow. This may be phlebolith. It's diagnostic when seen for the hemangioma, but if not present, it's not exclude hemangioma. This one, this hyperechoic flat mass, this is hemangioma. Retinoblastoma, this is the most common primary malignant tumor of the eye in children. This also appears as echogenic soft tissue mass with variable shadowing due to calcification and heterogeneity due to necrosis and hemorrhage, usually vascular on Doppler examination. This shows calcification mostly. Also, we see this retinal detachment with it, but because this separated from the disc. Here also retinoblastoma with some calcification inside and causes shadowing.
But that can be also a melanoma. Here, it's hyperechoic, it's narrow base. Except the age, maybe.
Melanoma, it's a low to medium echogenous tissue and with no calcification.
Oh, sorry.
Yes. But maybe hemangioma. Hemangioma, there is calcification and hyperechogenicity, but little vascularity. But here there is vascularity in Doppler.
So Doppler is of paramount importance in these cases.
Yes. Sometimes there is another lesions which are not masses. We should differentiate it from the tumor. Like in this case, subretinal hematoma. This is hematoma, not tumor, and doesn't show vascularity on Doppler study. And here granuloma, in this case related to histoplasmosis, and this is post-pulmonary TB. This is granuloma in the posterior wall. This is the region of the optic nerve and optic disc. Okay. Calcification. There is sometimes calcification on the optic disc, calcified plaques seen on the optic disc called drusen. These are usually bilateral and asymptomatic and may cause atrophy of the optic nerve. And the hyperechoic lesion at the papillae, they should be on the papillae, causing acoustic shadowing on ultrasound, and on CT may see as an hyperattenuated calcified lesions. The presence of the calcification and their location are the clues to the diagnosis. Non-specific chronic retinal calcification may also be seen, but they are far from the papillae. But in the drusen, they are seen on the optic disc. As in this case, this is calcified plaque on the optic disc. This is in case of drusen and hyperattenuated on the CT scan. And this one also calcification, but far from the optic disc. Here, the region of the optic disc. These are non-specific and may be related to retinal ischemia. Ultrasound is very important in detection of foreign bodies inside the eye in case of trauma. As we see here, this echogenic shadow is the foreign body, but in case of foreign body, there will be this shadowing, reverberation shadowing behind it.
Reverberation artifact.
Yes. Ultrasound also used for the estimation of the optic nerve sheath diameter, and it should be done 3 millimeter down to the optic disc, and should be less than 5 millimeter across. This, as in this picture, 3 millimeters down the optic nerve, and the diameter should be less than 5 millimeter across, and in children should be less than 4.
So if it is more, then
the indication of this indicates the increase intracranial pressure. As in this case, this is more than 5. This here is thickened and also associated with bulging of the disc. And that's all. Thank you.
Amazing.
Okay, thank you.
It's not an easy topic. It's very delicate, very sensitive
Are very
topic.
similar.
For the first instant, they appear similar. However, if you think about it, it's not that similar. And we had several different cases of ocular ultrasound.